Varicose vein is a condition where the veins become dilated, lengthened, and tortuous, and the valves of the vein it becomes incompetent. Because of increased pressure on the walls of the veins, the valves are drawn apart, due to which the valves it becomes incompetent. Superficial varicose vein can be seen on the skin through the naked eyes. So, what are the causes of varicose vein? Varicose vein can be caused because of hereditary. Sometimes the reason is idiopathic, which means the reasons can be unknown. Very commonly, varicose vein is seen in the people whose occupation demands long standing. So, it is commonly seen in traffic police, nurses, and shop attendants who have to stand for a long period of time. So, why does this happen? Because prolonged standing it causes the veins to become overextended, and because of the force of gravity the blood it pools down on the leg, and that gets and the blood gets stasis on the lower limb only. Next reason can be pressure on the abdomen. So any kind of pressure on the abdomen also impedes the flow of the blood, which leads to varicose vein. Now pressure on the abdomen, it can be due to pregnancy. As one of the complication of pregnancy is also varicose vein. So pregnancy can also be one of the reason of varicose vein. Any kind of tumor on the abdomen, tight belt and corsets can also impede the blood flow that can lead to varicose vein. So these are the basic causes of why do we get varicose vein. And yes, it is also seen that altered breathing pattern also affects the vein. So breathing efficiently and properly is important to avoid varicose vein. Now, what are the symptoms of varicose vein, or what does a person feel when he or she is having varicose vein is there is aching, fatigue, tiredness of the muscle. There is cramps of the gastrocnemius, that is the calf muscle. There is cramps on your calf muscle. There is congestion and edema of the lower limb. And yes, very importantly, constipation also causes varicose vein. So not only the veins of your limb is affected, but veins of the rectum can also have varicositis. Now, moving forward, what are the complications of varicose vein? What can varicose vein lead to if left untreated? This is not very common, but it can be seen. It is varicose eczema. Varicose eczema is one kind of skin condition where where the color of the skin it turns to red or brownish, and that part of the skin it becomes thick. Next is varicose ulcer. Next complication can be hemorrhage due to rupture of the vein because of too much of dilatation. And one of the dreadful complication is thrombosis. Thrombosis is one kind of life-threatening condition. So if you want to know what thrombosis is all about, stay updated. Do subscribe to the channel. Okay, so moving forward, treatment of varicose veins. So this is the basic treatment which everyone can do. Elevate the limb. Keep your lower limb elevated so that there is no impediment for the blood to flow back. So yes, keep the limb elevated. Do the movements of the lower limb. Lower limb movement is very much important. Important movements are your ankle pumps, isometric quads. So and yes, breathing exercise is also important, as I already told that altered breathing pattern also hampers the blood flow to the veins. So this thing is important. Ankle pump is very, very, very important. Ankle pump, and yes, also ankle rotations. Now ankle pump, isometric quads and ankle rotations has to be done quite swiftly, but do not do it vigorously. So this also helps in the flow of blood, and it is important to do all these exercise keeping your legs elevated. Next thing what you can do is wearing compression stockings, especially for varicose vein, specialized for varicose vein, and some kind of elastic bandages. Now this also helps, it works. So okay, one thing is important to be known, that while doing the exercise, this bandages or stockings has to be removed. Do the exercise, keep your limbs elevated, complete all the exercise, and before standing, wear the bandages back again. So that has to be known. And if the doctor has asked you to do the exercises while standing, so some exercises can be done on standing position also. So at that time, make sure that you are wearing the bandage and doing all those exercises. Now next thing is lifestyle modification is important. Avoid smoking, reduce the intake of alcohol. And for the people whose occupation demands long term standing, if possible, try to modify it, try to change it. So that will be very bad for me to say that try to change your profession just because of varicose vein. So what you can do is wear elastic stockings and elastic bandages and stockings. So that will also help you prevent varicositis. So yes, this was what you can do, the basic things. So at later stages, if untreated by all these management also, there a surgery is the option, where the ligature of the incompetent vein is done. And post-operative management is also the same. Bandage is necessary and early movement is required to come back to normal life. So this was all about varicose vein. Thank you.